Hi, I'm very pleased to present to you today this guide to support the return to work of employees who had been absent due to mental health problems. The guide I'm presenting to you today was produced as a result of several studies conducted with workers who had been absent due to mental health problem, and some of this research was conducted with the support of Robert Sauvé Research Institute of Occupational Health in Quebec. Our previous research showed us that most of the workers who had been absent due to mental health problems are absent due to work-related problems. And we also observed that the return to work does not mark the resolution of health problems. It was not because workers returned to work that their problems were solved. Many of the workers who had been returned to work were not doing well. So we were able to document that when the return to work process did not address work-related problems, the return to work was less sustainable and workers were more at risk of relapse. This reality is the same regardless the reason of absence, whether work-related or not. And the answer always depends on the ability to consider work in the return to work process, even if it's not always the main cause of mental health problems. Our research has shown that the resolution requires taking work into account. And in light of this finding, we conducted action research in a workplace. The objective of this action research was to design, implement, and develop a return to work support program with stakeholders in the workplace. Managers, unions, supervisor, health, and OHS worker representative, and also for workers who had been absent due to mental health problems. And this research was conducted in a health and social service organization in Quebec with 4,000 employees. The methodology was based on program theory and conducted so as to design a theoretical model and an operational model that we implemented and evaluated. And we conducted also interviews with all stakeholder groups in the workplace, and also we followed absence worker and their supervisor during the return to work process. This work has provided the theoretical and practical basis for the development of this guide. You can load the detail of this research in English on the Institute Robert Sauvé website. So the guide is a practical tool that combines individual support and organizational change. It is intended for managers, human resource services, and labor groups concerned about worker health and job retention, but also for workplace practitioners, including physicians and occupational health workers, organizational psychologists, and rehabilitation counselors. The main objective and the originality of this guide is to design a support program that will allow us to intervene directly on work-related problems, recognize the impact of work on health and the risk associated with work-related problems, and moving from an individual rehabilitation approach to an organizational prevention focus. This is the core of this guide. Several studies will address the individual factors of the worker with mental health problems, and this guide specifically addresses work issues from the standpoint of workplace health. We go beyond the identification of accommodation measures to create a healthy work environment that will answer the integration of all employees in the workplace and for job retention for all. The ultimate objective of this guide is to move from an individual rehabilitation approach to an organizational prevention focus. And this guide is divided in 4 parts. The first part presents the different aspects that must be considered before implementing the support process. These different aspects include the recognition of central impact of work on mental health And the process described in this guide involves going beyond individual basic intervention focused on psychopathology and medical treatment, and moving toward an integrated occupational health process that reflects the complexity of the human being at work and the need to put work at the heart of the process. But what does it mean to recognize the impact of work on health and risk associated with work-related problems? It means being willing to intervene in work organization. It means adopting practices based on the analysis of work situation, a perspective that fully engages workers and workplace stakeholders, including unions and the immediate supervisor and senior management. This is the core of the programs proposed in this guide. However, one of the big challenges of the effectiveness of the approach will depend on the ability to uncover the hidden face of contradictory practices, because workplaces are full of contradictions. On the one hand, they are the issues of economic rationality with the high cost of absence and the logic of insurance. On the other hand, there is the human and social rationality on health and well-being. These two rationalities are in constant conflict and result in a series of contradictory practices in the workplace. For example, we can see how senior management says that they want to implement a supportive approach, but at the same time maintain in place coercive measures to control absence, such as contesting disability claims or pressing for a prompt return to work without addressing work-related issues. Or supervisors were asked to listen to their workers to help them by improving the work organization, but at the same time, they are under pressure to lower absence rates, increasing productivity, and often do more with less staff. These contradictory issues undermine the credibility of the approach to disability management and the confidence of the stakeholders in being able to improve the situation. The groundwork must be done to ensure that the measures and practices adopted will be coherent. It is necessary to invest time to ensure that practices are consistent with the vision. I can tell you that this aspect of the process is very important to the success of such a program, and it's perhaps also one of the most challenging. So the second part of this guide presents the various measures to be taken to implement the recovery return to work support process. During this step, good intentions are translated into actions. Senior management must make a clear commitment to support its vision and what this means in terms of challenge. This vision based on the analysis of work and the challenge it raises must be shared by all staff, management, senior staff, and the union and workers. The role of responsibilities of each of the workplace stakeholders must be clear, and practices must be coordinated by a neutral facilitator. A neutral facilitator should be involved like a program coordinator, but it is important to choose someone who is seen to be credible by the workers as well as by the employers and its representatives. The third part details the 7 operational steps for supporting and monitoring absence worker and their supervisor. These steps are managed by a coordinator who will assist employees from the time they stop working until the follow-up stage after they return to work. These 7 steps include begin the process as soon as the first administrative procedures are initiated, make the first contact with the worker, assist the worker in his recovery, prepare for the meeting with the immediate supervisor, prepare for the develop a draft and return to work plan, and facilitated the return to work by implementing the plan, and also do follow up on the return to work and make any necessary adjustment. But one of the most important is to prepare for the return to work well before returning to work. This preparation helps to reduce the risk of negative anticipation of having to return to work under the same conditions that preceded the absence of from work. A space is created to discuss work-related issues and actions to improve the situation and facilitated return to work. This preparation included a meeting with the immediate supervisor to discuss work situations and plan the condition of return to work. We create a space to think about work, a space that gives the worker the possibility to examine his work, what he does, what difficulty he has, what makes sense for him in his work, what can be improved, to enable the worker not only to regain his or her ability to work and rebuild a positive connection with the workplace, but also to engage in a real discussion about work situations. This provides an object for discussion and action around work rather than around the disease. This discussion space helps to transform mental health risk factors into protective factors. The lack of recognition at work, poor support from superiors and coworkers, and lack of decision-making control to decide how to get the job done are the most significant risk factors for mental health in the workplace. The link between the presence of these factors, risk factor, and mental health problems in the workplace has been clearly demonstrated and validated by the scientific community around the world. Conversely, feeling supported in difficult situations, having an influence on their work, and feeling respected and valued are all factors in the prevention of mental health problems in the workplace. Being listened to, being able to discuss their work, and having support in their work are preventive factors in mental health in the workplace. It is in this sense and in this way that the approach makes it possible to transfer mental health factors into preventive and protective factors for mental health in workplace. I can tell you that it was really impressive to see the impact of this approach on our research intervention. But the major challenge for immediate supervisor is to recognize the impact of work and management practice on the health of workers. Shift from a paradigm of controlling absenteeism to one of supporting workers by focusing on improving work organization. And also the most important is being listening to by management and having the latitude to improve work organization. The immediate supervisor ability to listen to the employee's work problem depends on the supervisor possibility to be listened to by his managers. This last point, it is the most important. We cannot think of opening a space for discussion between the worker and his or her supervisor without there also being a space for discussion between the supervisor and senior management. This is why it is necessary to plan the process from the outset. The process must be part of the organization's real commitment to take action on mental health in the workplace. When I was talking earlier about having a coherent set of practice, this is one of the things I'm talking about. Here are a few examples of the action that were planned as follow-up the meeting between the worker and his or her immediate supervisor. Have a regular meeting and team meetings, clarifying roles and responsibilities, adjust the work schedule, planning a transfer to another department, determine when to update training and procedures, plan a work sharing with a colleague to update files or to minimize the workload for a period of time, prepare welcoming modalities for return, and prepare a work plan for difficulties that cannot be solved in the short term, and also plan the allocation of additional resource. I remember at the beginning of the process, the employers was afraid about they will be faced with some impossible demands. In fact, the majority of requests are related to simple good management practices. This fourth section describes the return to work process as well as action that can be taken to prevent mental health problems. We want to shift from rehabilitation to prevention. We are shifting from an employees assistance program to an organizational assistance program, an OAP. The question is, what concern one worker may affect also several workers? Based on the identification of work-related problems affecting the absent worker, we try to find out how these factors can also affect other workers. The idea is to identify some topics that will be used to initiate the discussion on preventive action in mental health, moving from a case-by-case intervention to one that targets all exposed workers. We move from rehabilitation to prevention in occupational mental health. We want to close the loop by starting with rehabilitation and moving up to prevention. The ultimate goal of this approach is to answer this shift. This is the condition that will ensure not only the return to work of workers who have been absent due to mental health problems, but also to create a work environment conducive to the retention of work and employment. This guide is useful for organizations that want to be proactive to support return to work and prevent mental health problems in the workplace. The objective is to go beyond the implementation of accommodation measures by acting on the conditions that support not only return to work, but also the retention for all workers. However, some workplace business and organizational are still reluctant to implement the approach that address the work organization, the work organization and the condition under which it is carried out. Sometimes, even if they implement an approach that addresses work organization, it is often accompanied by contradictory practice and action do not follow intentions. This is why the next step, we want to develop with and for trade unions an approach to return to work to support that focuses on the ability to identify work-related problems and put in place political and organizational actions to address work. This perspective includes consideration of three perspectives: work and working conditions, but also to work about the more invisible dimension of psychosocial hazard, including challenge and work-family balance, and also to include the legal context and its impact on workplace actors. Well, that's what I want to share with you today. You can get all of the detail of this guide, which is available at this address. And thank you for your attention.